If you're bleeding out and help is hours away, knowing this could be the one thing that keeps you alive. This guide covers critical procedures for treating severe injuries when professional help is unavailable. Important reminder: the information in this video is for educational purposes only and is not a substitute for professional medical training or emergency care. Always seek qualified medical assistance whenever possible. Now let's start. Your first objective is controlling blood loss before it becomes life-threatening. Locate the cleanest available fabric, whether clothing, towels, or any absorbent material within reach. Create a thick compress and apply firm, consistent pressure directly over the injury site. Think of this as containing an emergency rather than merely covering it. Maintain constant pressure without checking underneath. Each time you lift the compress, you disrupt the clotting process your body desperately needs. When blood soaks through your initial layer, simply add more material on top rather than replacing what's already there. This preserves the fragile clot formation happening beneath. For extremity wounds, positioning the injured limb higher than your chest helps reduce blood flow to the area. Physics works in your favor here. Torso injuries obviously can't benefit from elevation, so continued direct pressure becomes even more critical. Arterial bleeding presents a different challenge entirely. When blood pulses rhythmically in bright spurts, direct pressure alone won't suffice. You need something approximately 2 inches wide. Belts, thick fabric strips, or sturdy straps work well. Avoid thin materials like shoelaces or wire, which can slice through tissue and guarantee limb loss. Position your tourniquet several inches above the wound, always between the injury and your heart. Secure it tightly, then insert a rigid object, a stick, pen, or similar tool, and rotate to tighten further until bleeding ceases. The intense discomfort you experience confirms it's functioning properly. Document the application time clearly. Write it on skin, walls, anywhere visible. Prolonged tourniquet use causes tissue death. Giving you roughly 2 hours before permanent damage begins, you're essentially choosing between controlled bleeding and potential amputation. Once hemorrhaging is controlled, preventing infection becomes paramount. Contaminated wounds invite sepsis, which can prove just as fatal as blood loss. Irrigation means thoroughly flushing debris from the wound channel. Ideally, use boiled and cooled water. Bottled water serves as the next best option. Even questionable tap water beats leaving foreign material embedded in tissue. Pour water generously through the wound. You're washing away contaminants, not simply rinsing the surface. Saline solution is optimal when available. Hydrogen peroxide can bubble out visible debris but should be used sparingly since it damages healing tissue. Contrary to popular belief, distilled spirits don't sterilize effectively and cause unnecessary pain. After irrigation, gently dry the area with the cleanest fabric available. Gunshot wounds create cavities that require filling. Whether you're dealing with through-and-through injuries or retained projectiles, proper packing is essential. Sterile gauze is ideal, but clean fabric strips become necessary when medical supplies aren't available. Begin at the wound's deepest point. Using fingers or tweezers, carefully introduce gauze in layers rather than cramming everything in simultaneously. You're essentially filling the entire cavity to create internal pressure against bleeding vessels you cannot see. The packing should feel firm without being constrictive, tight enough to control bleeding but not so compressed that circulation is compromised. Exit wounds require identical treatment. Once all cavities are packed, cover everything with a larger dressing secured with whatever adhesive you have. Medical tape is preferable, but even duct tape serves in emergencies. Bacterial infection represents a delayed but equally serious threat. Broad-spectrum antibiotics, like amoxicillin or doxycycline, should be started immediately if available. Completing the full course matters even when you feel recovered. Premature discontinuation allows resistant bacteria to flourish. Without pharmaceutical options, natural antimicrobials become valuable. Genuine honey possesses scientifically documented antibacterial properties. Apply it to wounds before dressing. Crushed garlic mixed with oil offers another alternative, despite the pungent aroma. Traumatic shock often proves more dangerous than the injury itself. Your body's extreme stress response can cascade into system failure. Warning signs include pale complexion, rapid pulse, difficulty breathing, mental confusion, and cold perspiration. The particularly concerning aspect is that confusion prevents you from accurately assessing your own condition. When shock symptoms appear, lie down immediately. Elevate your legs if possible. Focus on warming your body with available coverings. Consume small amounts of water gradually. Your digestive system isn't prepared for large volumes. These interventions work by supporting your body's natural healing mechanisms. Blood clotting involves platelets aggregating to form barriers against further loss. Applied pressure helps these cellular sandbags stack more efficiently. Tourniquets temporarily halt blood flow to the injury site, buying time for clot formation. Wound packing creates structural support for tissue repair while maintaining crucial internal pressure. Antimicrobial treatments eliminate bacteria before they can establish infections, allowing your immune system to focus on healing. Surviving the initial hour dramatically improves your overall chances. Making it through the first 24 hours suggests you'll likely continue recovering. These aren't guarantees, they're statistical realities of trauma survival. This represents the harsh reality of emergency medicine without infrastructure. No ambulances, no surgical teams, no morphine. Just you, improvised supplies, and determination. But if you've managed to control bleeding, pack the wound, and maintain consciousness, you've achieved something significant. Monitor for infection signs. Increasing redness, swelling, and foul odors indicate complications. Clean, healing wounds with manageable pain suggest successful treatment. Either way, you've demonstrated that basic knowledge and steady hands can mean the difference between survival and becoming another casualty.